Namaste. I am Dr. Shantakumari, Chief Physician of Vata Ayurveda Eye Hospital, Thiruvananthapuram, Kerala. Now I am discussing about a particular eye disease, glaucoma. Actually, glaucoma is an eye disease. It is a typical eye condition or a group of eye conditions which affects the optic nerve of the eye. And optic nerve is the particular nerve among the 12 cranial nerves. Second one is optic nerve, and this nerve is the particular nerve that connects eyeball with the brain, and this nerve transmits the impulse developed in the eyeball to the brain. So the impulse is formed in the eyeball on the retina by focusing the light rays which is converging in that part, which is reflected from the object, and this impulse is transmitted through the optic nerve to the brain for the perfect visual sense. So from this itself it is clear that if there is any defect or any pathology developed in this optic nerve, vision is not possible, or different types of visual impairment or visual defect may develop. And in the case of glaucoma, the reason behind this, why this optic nerve is affected, it is increase in the intraocular pressure. The main reason, there are some other reasons also. The main reason is an increase in the intraocular pressure. What is this intraocular pressure? Shortly known as IOP. In the eyeball, there is a fluid system, mainly two types of fluids. One is fluid, thin fluid substance, aqueous humour. The other is vitreous humour. The aqueous humour is in the anterior chamber of the eyeball, and vitreous humour is in the posterior chamber. And the aqueous humour is actually filtered from the blood vessels, the arteries, and is circulating inside the eye anterior chamber and is nourishing the parts. And after circulating inside and nourishing the structures, it is drained out to the general venous system. This is the situation. So it is filtered from the these arteries just to remove the opaque particles, especially the red RBCs, because all the structures inside the eye is transparent. Only through the transparent medium the light rays can pass and do its functions. So to keep the transparency of the eyeball is absolutely necessary for the functioning of the normal visual process. So this aqueous humour is the functioning matter behind this. So after this nourishment, it should go to the venous system through a channel. Aqueous channels are there. So when there is a blockage or any restriction to the drainage system, then there will be an accumulation of this fluid inside the aqueous chamber, and automatically the pressure may increase. So IOP is the pressure inserted by the aqueous humour in the aqueous chamber, especially the walls of the eye chamber. So when this is increased, it will make the impact on the other structures of the eyeball, and when it touches the optic nerve, then the possibility of developing glaucoma is there. So in short, two things: the damage to the eye, optic nerve, and the increase in the IOP. These are the two factors to be considered in the case of glaucoma and its treatment. Now, there are different types of glaucoma. One is this open angle glaucoma. I am talking about it only now. And the other group is congestive glaucoma or closed angle glaucoma. There is another group which may be developing as a secondary type. That means as a result of complication of other ocular disease, sometimes other systemic disease also. Some ophthalmic conditions like uveitis or other posterior parts, inflammations, etc. may develop sometimes increase in the IOP and develop glaucoma also. In the same way, some systemic disease, especially even diabetes, may bring its complication as glaucoma. So these are the different types, and now I am talking about only open angle glaucoma. This is the most common variety among all these types. So we have already seen that there is a blockage to the drainage system. Now coming to the Ayurvedic analysis. Any blockage or any block to the channels is due to the aggravation or the vitiation of Kapha. So when there is a vitiation of Kapha, there is a possibility of blockage, and in the case of this ophthalmic situation and this drainage system, it indirectly makes some increase in the pressure, and this in turn goes to glaucoma. This is the root. So the basic thing should be this blockage, and then secondly comes the functioning of the optic nerve. So when we come to the actual fact, this Kapha related to this eye is Tarpa Kapha, and when come to the optic nerve part, it is mainly the functioning of Prana Vayu. So these two things should be considered equally in the treatment of glaucoma. And first of all, we have to remove the blockage. For that, Shodhana Chilsa, the term is like that in Ayurveda, which makes the channels clean or clear. That type of treatment should be the first line of treatment approach. For that, there are different types of medicine, oral medicines and ocular medications and extraocular medications. All medicines is one group, and extraocular medication is very important in this case because this optic nerve is not inside the eye, it is starting from the eye and it passes through the head region to the brain. So we have to consider that also. So Nasyam is an important thing in the case of treatment procedures in the management of glaucoma. And also the ocular medication, different procedures are there, and among the various procedures, Anjanam, that's applying the medicine as a collyrium inside the eye, known as Anjanam, that is very important. So this type of treatment procedures which is capable of making the channels free and clean so that the circulation can be maintained in its normal way. That is the first step of treatment. The second step will be focusing on the maintaining of the functions of optic nerve. There is necessity of Vata Shamana Chilsa is very important. And that type of treatment will be focused not only in the eye, or it will be focusing on the head region also, because the seat or the site of the optic nerve is not inside the eyeball. So different types of Shirodhara or Shirovasti and that type of procedures known as extraocular methods are selective in the management of this glaucoma. Then the next comes the strengthening of the structure. After controlling the drainage system and also strengthening the nerve, we have to make the eyeball stable or make it the functions bring to normal routine side. That also is important. So for that also the medicines is more important, selection of the medicines. There is different types of medicines, but some drugs are having very specific reactions or actions in the ophthalmic tissues, because it is applicable for any organ also, because we have to very well clear that the medicine which is acting in the heart will not be acting on the calf muscles, or the medicine in the stomach will not act in the head region, like that. Each drug is having its own site of action pharmacologically. So we have to select that type of drugs or medicines only. These are known as Chakshusha Dravyas in Ayurveda. So by selecting this type of Chakshusha Dravyas, we have to perform these treatment procedures first to clean up the drainage channels. then to maintain the Vata properties, and finally strengthen the system as such. If all these things are done correctly by an expert hand, the glaucoma is treatable. We can improve the vision also.